Hello and welcome to this week's What Were They Thinking? This week's news covers things like the rather unsurprising news that COVID-19 vaccines are not linked to deaths, the association of even more mild infections of COVID-19 with significant changes in the brain, the unfortunate news that the first pig-to-human heart transplant has ended unexpectedly, and the interesting development, or at least common developments, of various neurodegenerative disorders. The timestamps for these and other news items can be found in the description box below. Let's start with the unsurprising news. A large-scale study in the United States of America looked at the vaccine adverse events reporting system. This examined the reported adverse events between December 14th, 2020 and June 14th, 2021. They looked at it as categorizations of non-serious, serious, or death. They looked at data from reports that occurred up to 7 days after vaccination. They then tried to figure out what was going on and if there was anything important to come out of it. Note that this data set covers nearly 300 million doses of vaccine given out in recent years. 92% of the reported side effects were mild. Think about things like headaches, slight pain in the site of injection, inflammation, redness, things that aren't going to cause you much in the way of any quality of life reduction, but are notable. There was also no unusual patterns that linked the number of people dying and the time frame of their death with the vaccine. This is a rather important link. If you can take all of the normal death rates and you overlay it with vaccination data, and you can see, is there a spike within a certain time frame after the vaccine, you can find out a lot more and be able to differentiate it between the normal background level. That's why this study is important. They did not find that unusual difference. The roughly 300 million doses did lead to some somewhat more serious side effects. This is about 22,000 things like shortness of breath. Again, not going to cause death, but important to note. There is the far less common case of heart inflammation or myocarditis, but that's limited to only some of the vaccines and not all COVID-19 vaccines. The approximately 4,500 deaths that were reported in the time frame that was considered relevant for this study had more than 80% amongst those who were 60 years or older, a group already prone to adverse reactions and has a higher baseline level of mortality, making it hard to differentiate between vaccine deaths and otherwise normal deaths. The remainder were largely represented with things like anaphylaxis, which, depending on your history and the vaccines in question, can sometimes be difficult to identify before a vaccine is administered. Still on the topic of vaccines, but moving to the purported leaked Pfizer documents that are meant to be revelatory and groundbreaking, but really aren't. The documents themselves are the product of using Freedom of Information requests. This request is an important part of any government in order to provide some degree of transparency. The caveat to Freedom of Information requests under just about every circumstance is that they make very specific inquiries and pose very specific questions. If the information does not relate to those requests or information and questions, it's not provided. That means if you have too broad a scope or too narrow a scope, you may either get too much information or may not get any information at all. And that's where these documents become very important. What was requested, what was provided, and what was not provided can mean very different things on how you look at these documents. They all relate to data that occurs fundamentally since December 2020, and only goes through to the end of February 2021. All the data that's being spoken about here is from the public administration of the vaccine and those that are reporting adverse events. Fundamentally, something very similar to the VAERS data, or Vaccine Adverse Events Reporting System, that we just mentioned. This means a self-selecting population has to go out of their way to tell the company about these problems. If you've ever run any kind of community group, been on a committee, or had any other kind of leadership role, you would know how hard it is to get people to do things themselves without being told to do it. The same thing occurs here with this data. It is a self-selecting population, and we need to take it with a considerable amount of salt. This is one reason why you should take the claim that 3% of the people involved in trials, which this doesn't relate to, died after enrollment and within 3 months of the vaccines being given out. It's not an accurate description of what this is reporting at all. It's reporting that of the millions of doses given to the public, 3% of those people who reported back to Pfizer mentioned that the person had died, and not necessarily due to the vaccine. As mentioned prior, elderly people were particularly prone to dying already before the vaccine, and there's also things like anaphylaxis. This means you need to take what is being claimed, which is oftentimes incorrect anyway, and examine it in the context of what was actually requested and what was actually provided. Based on that data, you can conclude that the vaccines were safe, effective, and the conclusions some people are touting about this simply aren't true. The risk of vaccines are tiny. In fact, the adverse reactions relative to the number of vaccines administered across the board are almost negligible. Compare this then to the risk that arises from infection with COVID-19. There's already things like blood clot risks, sterilization risks, fertility risks if you're not sterilized, lung function problems, and long COVID, which is a largely neurological problem in some cases. Exactly how neurological problems arise is now a big question, and that's where another study this week will help to provide some elucidation, but we're still looking to try and understand what's happening. It involved 785 people, so a relatively small cohort, aged between 51 and 81. So again, we need to be aware of limitations when it comes to the nature of old people. The scans were conducted approximately 3 years apart, and they were also coupled with cognitive testing. What they found when they did this, and bearing in mind it is a preprint, so take this with yet more salt, is that those who had been infected with COVID had notable changes in their brain, and they're not sure if they'll be reversible. The changes found were noticeable in areas of the piriform cortex, olfactory tubercle, and anterior olfactory nucleus. Those are parts of the brain associated with taste and smell. There's also some role for these areas in memory. That may explain why when the tests were performed, there was a negative association with cognitive function if somebody had been infected. This was reinforced by atrophy in the cerebellum. More often than not, something like this would be associated with a serious infection, leading to not only systemic issues, like inflammation right across the body, but serious infection that requires the body put all of its effort into trying to fight off whatever's caused it. In this case, the majority of those who had been infected with COVID-19 did not have a serious case, and only 15 of them had been hospitalized due to COVID. This means a vast majority, in fact nearly every single case, showing a reduction in brain function and adverse effects were in otherwise mild cases of COVID-19. That is a big and important finding, and it does give further reinforcement to the idea we've posited before. COVID-19 will have long-term healthcare ramifications far down the track from now, when we begin seeing older people going in the healthcare system on a more regular basis due to complications arising from COVID-19 infection today. That, of course, assumes that COVID will either become endemic or peter out. If it is the latter case, then the research we've just described didn't account for things like Delta or Omicron variants, which are so much more prevalent at the moment. Going from the infectious disease side of things to medical care and organ transplants. About 2 months ago, we reported how the first successful pig-to-human heart transplant had occurred. It involved a 57-year-old male who had heart failure and had volunteered to receive the experimental genetically modified pig heart in an effort to be able to get a heart transplant in the first place and prove the concept effective. He received the heart took for all intents and purposes, and there was no obvious rejection. It was functioning, and he seemed to be able to go back to some degree of normal life. Unfortunately, he's now died. Why he has died isn't yet clear, and that's going to be a very important thing that needs to be found out, given that this kind of development could significantly reduce the number of people waiting on an organ transplant. If it's the heart, lungs, or liver, theoretically, the approach taken to genetically modify the pigs for the heart could, to some extent, work for other organs. One thing that has come up out of this trial, so to speak, is that balancing the use of immunosuppressants and avoiding issues to do with infection was much more difficult with this patient, and that's something that the doctors have noted. They were trying to balance the use of immunosuppressants and controlling an infection that had developed. None of this is to take away from the fact that somebody volunteered to have a heart transplant when they otherwise weren't eligible to have one using an experimental heart, and in doing so have theoretically opened the door to allow for many other people to receive heart that they otherwise would not have had. Similarly with other organs that are in high demand but low availability. The fact that the patient has died is a tragedy, and it would have been that much better had they been able to live out their life in full for as much time as they had left, rather than dying. But as it stands now, this may at least provide one last gift, so to speak, in finding out just why it happened and if other people could theoretically have their life extended considerably by having pig-derived organs instead of having to wait on a human organ donor. In other medical news, the issue around lead exposure, especially in America, is a big problem. Consider what happened in Michigan in the last few years with Flint. Flint had its water supply contaminated with heavy metals. This could possibly lead to lifelong disability and debilitation for children who have grown up drinking town water. This relates to another retrospective study, and it's healthcare oriented but looking at the US and lead-based contamination. Leaded gas, leaded paint, leaded in water. There are many ways contamination could occur and could then present issues for those who consume it. Keep in mind that lead is a very bad thing for the nervous system. It can cause serious brain damage and impede brain development. The researchers took an initial average approach to this. They did that by taking the total number of theoretical lost IQ points and dividing it by the population. That led to an average of 3 per person. 3 per person means that there could be some who have lost no IQ points, and some who have lost much more than 3. If you were born in the 60s and 70s, this would also be the group that was most affected by it, and so you would see a diminishing effect over time for most of the population. Depending on where you live, where you have lived, and your age, the exposure to lead could have long-term and current ramifications for you and your relative risk of other conditions. Cardiovascular disease, cognitive function, renal function, propensity towards cancer. There are all sorts of things that could have an association with this lead exposure and its considerable effect, not just on IQ, but other things. Finding that common ground is the only way to be able to figure out who's been affected and how best to compensate for that harm that it's occurred. Even if you aren't exposed to lead, you still have a certain intrinsic risk when it comes to neurodegenerative diseases, and these are rather insidious. Alzheimer's, for example, can creep up on you completely unawares until one day the penny drops and you become aware of it, or someone else identifies it first. There's no treatment, there's no way to really stop it from happening. At best, you can hope to maybe slow it down. Even then, there's not a lot of hope in the long term, at least for now. Being able to find out what causes neurodegenerative diseases is going to be a big thing once it happens. The problem is, they nearly all have their own separate causes. But there may now be a common link between some of them. The three diseases that they think may have some common relationship were frontotemporal dementia, progressive supranuclear palsy, and dementia with Lewy bodies. 11 patients who had donated their brains to be able to provide samples all had similar protein fibrils or tangles found within them, and these could all theoretically be related to the final outcome of the disease. The protein tangle that we're talking about is relatively unique to these three conditions, and that's why they believe there may be some commonality. The protein itself is called TMEM106B. Normally it's found in the membranes of lysosomes and endosomes, which are involved in packing away and storing cellular debris. This ensures that when cells begin to wear out, undergo lysis, or otherwise malfunction, the material doesn't spread everywhere and can be removed gradually. The malfunctioning protein can then kickstart a process of causing other lysosomes to malform and malfunction, and this then leads to the creation of more malformed protein. These fragments are like dominoes, and as they spread, the condition gets worse. The challenge for this research, and perhaps its biggest limitation, is that these particular protein bundles aren't unique to these disorders, but the commonality between them is unique. If that doesn't make a lot of sense, it's because it's very much splitting hairs. The presence in multiple disorders with relatively common features is a good sign that there may be something there. But is this the cause or the result of neuropathology that needs to be elucidated in order to understand whether or not you can target this as a therapy, or if it's the result of something else that you will need to target to treat these neurodegenerative disorders. Finally, something somewhat more mysterious but also much more interesting is an example of the old adage: anything suitably advanced or unknown can be mistaken for magic. In this case, a 300-year-old mummified mermaid. The mermaid was seen as a mystical thing that was found, and it was held by one of the members for the Okayama Folklore Society. It's only a relatively small specimen at about 30 centimeters or 12 inches in length. It's been stored, more or less, for those 300 years in its box. The mummified mermaid, however, is less a mermaid, and now that we have suitable means of exploring just what it is, the mystery is disappearing. It is in fact a combination of monkey and fish. Exactly what kind of monkey and what kind of fish won't be known just yet, but there is DNA research being done to try and identify that element. What is known is that similar charlatan-type products were made extensively around the same time frame in the mid-18th century, and sold to curious Westerners. While fraud isn't exactly the word for it, it is very close. What this is in the end is a cultural artifact that is worth being aware of, and hopefully more people will take an interest in their cultural studies as a result of the further information that is now known about this particular mummified mermaid. That's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.